There is one Calgary catering company right now doing its best, though, to ease that strain and let healthcare workers know that there are people who are applauding them, celebrating their sacrifice. And that is a story that we are happy to bring you this morning. J'Val Shuster is with me. She is the owner of Devour Catering, the specific company in question, and she's up with us in Calgary today. J'Val, welcome to our program. Really great to meet you.
Nice to meet you too, Heather, and thank you for having me.
All right.
Great.
Well, it is great. It's a great story, and I just want you to tell us about it. This program that you have started, you brought it into effect in mid-September, as I understand. Tell me about it and what gave you the idea to start it up.
Well, as you know, the fourth wave is pretty intense here in Alberta, and so in the middle of September, the latest round of restrictions were introduced, which only allows for private gatherings of up to 10 people from 2 households. So as a catering company, we do a lot of private gatherings. So we had to endure another round of event cancellations again I've lost count how many times that's happened. And so I was feeling really discouraged and tired and just kind of wondering, okay, how are we going to dig deep and, what are we going to do next? And one of my sort of go-to things when I'm feeling like that is to think about what I'm grateful for. And so it was kind of a combination of feeling intense gratitude for the people working in the healthcare system and also, wanting to figure out how to help. I can't work in a hospital. So I put the idea out there to Julie Van Rosendahl, an amazing food writer here in Calgary, that I wanted to come up with a way to be able to nourish people in the hospitals. And somebody had reached out to her and said that they had some people together and they had contacted an ICU department. And so we kind of combined forces and did a trial run on September 29th. We took 50 meals up to the foothills. And after that happened, we got great feedback from some nurses and people kept giving money. And so I thought, well, for Thanksgiving week, let's put this out there as a package that we can offer for all of the hospitals. And I sent it out to our clients in our newsletter last Wednesday, so just a week ago today. And just to, we don't have millions of subscribers or anything like that. But within 24 hours, we had already 500 meals purchased. Several people stepped forward and bought an entire unit in one purchase. They would spend $750. Just to buy food for
feed
an
all
entire
the staff
unit.
in one hospital unit. That's amazing.
Yes. And it hit social media on Sunday and just took off. And I haven't checked the number yet this morning, but we are at over 6,000 meals have been purchased by approximately, 1,600 people. So it's overwhelming in the best way. That's what I've been saying. And everyone can send a message when they purchase the meals. And the messages they're so heartwarming. I start crying.
Share some of them from, the online article at CBC News when I was reading about it through our Calgary colleagues. Some of the messages were there. We'll pull some up on the screen as you're telling them, but I don't know if you have any in front of you, if you remember any by heart. Tell me the kinds of So when people make a donation, they're also including a message to the healthcare worker who's going to enjoy the meal. What have they been saying?
One of the ones that I keep thinking about is there's a family that bought a whole unit and they want it to go to the South Health campus. And they just wrote about the amazing care that their mother received while she was there. And how important it was to their family and to her, and that they all still think about the doctors and the nurses who took care of her. We've had some from people who have been in the ICU and have recovered and have from COVID and want to make sure that they can express their appreciation. It's really amazing. I had somebody call me yesterday. He and his wife want to purchase an entire day's worth, so the day shift and the night shift for 2 hospitals. And just because everybody really just wants to do something, Heather. The situation has been going on for so long and there's so many people suffering. And now the people who are looking after us are suffering. And I think we're the majority. We're the people who want to do something and want to make this end. And the problem really is there's too many people in the hospital.
Yes.
I shouldn't, as much as I love to be able to help this way, this isn't what I should be doing.
Well, you should be dealing with events and helping people celebrate. That's, of course, what we should do, and hopefully you'll be able to do that soon. But you hit on a very important point there, J'Val. I have all sorts of questions, but I'd rather just sit here and listen to your story because you tell it in such an engaging way. When you say we are the majority, unfortunately, when we've been talking about on this program and elsewhere, you talk about Alberta, you're seeing protests, you're seeing anger, you're seeing politicization, you're seeing division. And a lot of times the healthcare workers in the hospitals themselves are being targeted by this. So I listened to you and how people have responded, and in some ways it feels like an antidote to all of that. Is that how you see it at all?
I hope so. I mean, when I did see the protests at the hospitals, it just was almost physically painful to watch that. And it's a really difficult situation. If you're staying home, if you've been double vaccinated, you're wearing masks, you're following the rules, you're not attending gatherings, it's really hard to show public support. It's really like, how do we come together? I mean, the majority of Albertans have been vaccinated, and I have to believe that the majority of people want this to end. And so we have to sort of tap into that power of good and power of, we have to figure out a way to move forward that way. And I just think every single person in my family has been deeply cared for by the healthcare system.
Yes.
Honestly, we've had to rely on emergency care. And so I'm thinking of the people out there now who need that emergency care and can't access it. And that is heartbreaking as well.
But let me ask you, J'Val, as you talk about this so passionately, it began at a difficult moment for you, another challenge for your company, and you said you focus on that, the gratitude. And now you have tapped into clearly a whole province wanting to show gratitude here. But for you, as you get set to provide such a meaningful Thanksgiving for so many, what does this now mean to you?
That's a good question. I think it means that if you can tap into gratitude, and if you can help other people tap into that, they will. I do believe that people are good. We are inherently good. We want good things. And so I just really want to help people keep facilitating that. I mean, really catering, we help people celebrate, right? So I am really passionate about that, about connecting people together, reminding people of, life is worth celebrating. There are many things that we all do every day to connect each other. And I think this has really helped me to remember that that's what we're all here for. Yes. Yeah.
What a pleasure to meet you today, J'Val. Since the beginning of the pandemic, and we've gotten away from this a little bit because it's been, as you said, it's gone on for a long time, but we've always tried to celebrate on this program the heroes and the helpers, and you are definitely in that category today. Thank you so much for sharing your story, and best of luck. You're going to need extra staff because you're such a success this Thanksgiving weekend. Thanks again, J'Val.
Happy Thanksgiving, Heather. Thank you.